Is home birth safe or dangerous? Let's look at the evidence on this controversial topic. So, some research studies in the US have shown that there's a higher risk for newborns that are born at home. Some have found a higher risk for newborns having seizures, even brain damage or death. But others have criticized this research, and that's because in a lot of those research articles, they did not differentiate between if the home birth was planned or unplanned. They did not differentiate if mom was high risk or low risk, and also they didn't give the description of the qualifications of the birth attendant. And by the way, all of my references, there's a link in the description that you can get a PDF of those. So what about research in other countries that have more home births than the US? Well, in Italy, they found that maternal and neonatal outcomes were similar for planned home birth and hospital birth. Also in the Netherlands, they found no increased risk of adverse perinatal outcomes for planned home birth with low-risk women. Now, perinatal includes outcomes for mom and baby. So then in summary, if you look at all the other countries that do have home births more common than the US, what they found is that if the midwifery system is well integrated with the physician and hospital system, then they found perinatal outcomes for planned home births are not statistically different than planned hospital birth. So why is home birth safe in other countries compared to the US? Well, if you look at their systems that they have in place, they have specific criteria for low-risk women who can safely give birth at home. Also, the home birth midwives, as we said, they're integrated and collaborated with the medical community in those countries. So that means like if there's a problem during the pregnancy, they can refer that patient on to a physician, or even during labor and birth, they can transport that patient and there's a seamless transition of care. Also, they do have credentialing of midwives, and it's a little different than in the US. We also have credentialing, but the licensure among the different states can be different. And then also it's their standard of care. If you're a normal, healthy, low-risk woman, you're going to be cared for by midwives and then only referred to a physician if there's a problem. Do you want to be prepared and not scared for birth? Just look in the description. There's a link that you can get a discount on my Childbirth Education classes. Okay, back to home birth. So this is a study that was in the state of Washington in the US, and they looked at home births and birthing center births. And all of these patients were attended by either a certified professional midwife or a certified nurse midwife. And they had strict criteria there again for the low-risk patients who could deliver at home and also for the birthing center births as well. They also had guidelines for when the patient needs to be transferred. So what did they find in this study in Washington State? They found that rates of maternal and newborn adverse outcomes were similar between birthing center births and home births. Also, the perinatal mortality rate, so that would be if a mom or a baby would have died, that rate was comparable to other countries that use midwives more, and also it does match the benchmark that is set by the American College of OBGYNs. So the author summarized by saying that these findings suggest that when you have community midwives that are integrated into the healthcare system, hospitals, birth centers, and homes can all be safe settings for birth in the U.S. So this was the first of my home birth series. Please watch the next one, Why Choose Home Birth, which includes the advantages of having a baby at home.